So, very warm welcome, everyone. Myself, Dr. Tanema Singhal, and welcome you all for today's Q&A session on Ask Me Anything on related to breastfeeding your baby. So, myself, Dr. Tanema Singhal, welcome again to all of you, and let me start the session today. Any of your questions, please put them in the Q&A box, and I'll answer them. First, as we always do, first I'll take the questions which have been asked by mothers on our Google form. So many of you are in our 30 days email series, and which is a free series, and to just educate our mothers about lactation, about breastfeeding. So most of you are part of our 30 days email series. So the questions which you have all filled, I'll first answer those questions. Along with that, after once I finish those questions, I'll take the questions which you are writing in the Q&A box. So let me start the session. So first question is from Bhavna. While breastfeeding, my baby is crying, although my breast having milk. Why like that? So Bhavna, first of all, I don't know what is the age of your baby, but I understand whatever is the age, if the baby has been introduced bottle first, or by katori, or by palada, the baby understands the source of nutrition as the katori or the palada or the bottle. So now if you are trying to bring the baby on the breast, the baby will not understand that. And specifically the skin texture. The babies, if they are exposed to the bottles, they understand the texture of the bottle nipple. So when you bring them to the breast, they don't understand skin. Many of you have heard from the mothers, my baby comes on the breast but doesn't suckle, because they don't know that they can get milk from there also. They come on the breast, they hold the breast, and they keep looking there to their mothers innocently. What has to be done? And suppose they are not coming on the breast, they will cry, because they don't know that they can get milk from the breast also. So what is the thing? So suppose if we have to teach them, then what we have to do? We have to do for every breastfeeding session, we have to try. This is called as trying. Okay, you have to first try. Understand the psychology of the baby. Baby doesn't understand. It is not like the baby is refusing the breast. Baby doesn't know about it. So what you have to do whenever you are trying to feed the baby, first try to put the baby on the breast. Now, if the baby is crying, not coming on the breast, it's okay, relax. You give whatever medium you have been giving till now. Maybe bottle, baby palada, or maybe katori. You give the baby the feed, but as the baby takes half of the amount, now you try again. Now, why are we doing this? Now, the baby has got little milk, so the baby is not very hungry. So the chances of cooperation will be better. Now, one thing, few things are here. Many of you say that my family members told me to keep the baby very hungry and then try. So first of all, this is a myth. If the baby is very hungry, the baby will not at all cooperate. So don't try to feed the baby when the baby is very hungry. Second thing, many of you try in the day, but in the night happily give bottle to the baby, thinking that let the baby also sleep properly, let me also sleep properly. I don't judge you there, but if you want your baby to come on the breast, then you have to make these persistent efforts both in the day and the night. You can't expect your baby to come on the breast in the day and in the night the baby should take from the bottle. It doesn't work like that. If you are trying, then you have to try both day and night. Now, next thing is, some of you tell me that I try, ma'am, 3 to 4 times, but if the baby doesn't come, then I just leave. I feel bad that the baby is not coming. So understand that the baby is not refusing you. The baby is not refusing the breast. The baby doesn't know about that. So you have to consistently do this for at least 7 to 10 days. And then you see. Then the only thing is that you have to do it for every feeding session. Okay. So Bhavna, if you have good milk supply, then just work on bringing the baby on the breast for every feeding session in the starting and also in the mid bottle feeding or mid katori or the mid palada feeding. Just try doing this for 7 to 10 days, and then obviously your baby will come on the breast. And also the correct techniques. Many times I have seen the mother is holding the baby and just thinking that the baby will come by himself or herself. No, you have to do proper latching techniques. So just watch the videos, which I have a lot of videos on my YouTube channel. You can watch there and you can work on that. Still, if you are facing issues with like bringing the baby on the breast, please reach out to the team and we'll try our best to help you out. So now, girls, I want to make an announcement. Now we have 3 lactation doctors in our team and 1 latch expert in our team. So many of the mothers, they have good milk supply, but there are a lot of issues related to latching. So I have a dedicated latch expert in my team and 3 lactation doctors, and me also. So including me, we are 4 doctors team, lactation doctors, who will help you in your breastfeeding journeys. So don't worry if you first try by yourself, but if it is not working for you, reach out to our team. Okay, Bhavna? Now, next question is, I'll keep taking from this side also. So some questions have come in here also. Next question is from Vandana Shinde. My baby taking breast milk for 1 hour, but during this, he sleeps in between. He takes formula milk of around 45 to 60 ml. Please guide on how to reduce formula milk and how to keep him awake during breastfeeding. Very good question. So let's understand the concept of active feeding and passive feeding. Many of you, this has been a question asked by so many mothers, that my baby sleeps on the breast. My baby keeps feeding for 1 hour, for 45 minutes, 1 hour. Still, my baby is hungry. And my baby can still drink the amount of milk which the baby usually drinks when I don't breastfeed him. This is correct. So now what you have to do, you have to observe the baby's feeding pattern. Babies, when they do feeding, then as you imagine, if you are drinking some liquid, you will see some gulping movement in your neck. Same thing you have to observe in your baby's neck when the baby is drinking. So when the baby is drinking milk, you have to see that gulping movement. If you see that gulping movement, that means your baby is doing an active feeding. If you're not seeing the gulping movement, that means your baby is not breastfeeding. The baby is only moving the mouth, like he's just pacifying. You would have observed your baby that even during sleep, they keep moving their mouth. So that is a natural reflex. When the baby is coming on the breast and you're not seeing the suckling movement, this gulping movement, that means your baby is doing a passive feeding. That is a non-nutritive sucking. So how you will know that my baby is drinking or not? By seeing the gulping movement. So as you said that your baby is coming on the breast for 1 hour, but still taking 45-60 ml milk, then first focus on one thing, that your baby should be active feeding 1 hour. Second thing is that how to reduce the formula milk. You have to see your baby's weight gain. So your baby is, you have not mentioned the age of your baby. If your baby is less than 3 months, the baby should gain 200 grams per week. So what you do, on day 1, you check the baby's weight, and then on day 7, you check the baby's weight. If your baby's weight gain is more than 200 grams, start reducing formula slowly. So what you do, you can start reducing 10 ml every feed. So if you suddenly stop formula, that will not help. What you can do, start reducing 10 ml from each feeding session. So if you are giving 8 times feeding, imagine you are starting reducing 80 ml per day. So this way, slow movements you have to do. And if your baby is constantly gaining weight, then keep reducing the formula. Okay, Bhavna? Oh, sorry. Okay, Vandana? So I think I answered your question. Next question is from Brini. Hello, ma'am. My baby is 1 month old, but जब भी उसको feeding करवाती हूँ, वो रोता है. उसको bottle feeding शुरू करनी पड़ी. But अभी क्या है अब आगे? पूरा क्वेश्चन क्या है बच्चा? आपका पूरा क्वेश्चन नहीं आया मेरे पास. ब्रिनी, जस्ट राइट योर फुल क्वेश्चन. आपका पूरा क्वेश्चन नहीं आया ब्रिनी, आप पूरा लिख दो, देन मैं आपका क्वेश्चन का आंसर करती हूँ. कौसर सेज माय बेबी ड्रिंक्स ब्रेस्ट मिल्क ओनली फॉर 5 मिनट्स. ठीक है कौसर, देखो इस चीज से मत सोचो. कोई हम लोग, अगर हम बड़ों की भी बात करें, एक रोटी खाने में शायद मुझे 5 मिनट लगे, दूसरे किसी को एक रोटी खाने में 2 मिनट लगे. आई मीन 2 मिनट तो बहुत कम है, ऐसा खाना भी नहीं चाहिए, प्रॉपरली खाना चाहिए. 5 मिनट भी बहुत कम टाइम है. आई मीन टू से, अगर हम एक रोटी, कोई एक जना 10 मिनट में खाता होगा, दूसरा जना 15 मिनट्स में खा सकता है. तो आप बच्चे का कितना टाइम में वो फीडिंग कर रहा है, इससे फर्क नहीं पड़ता. आपको देखना है कि बच्चा ब्रेस्ट एम्प्टी कर रहा है कि नहीं. तो कौसर, आप क्या करोगे, अगर आपका बेबी 5 मिनट्स ही फीडिंग कर रहा है, तो फीडिंग के बाद आप मिल्क का कलर देखना. अगर ब्रेस्ट मिल्क का कलर थिक व्हाइट हो रहा है, मतलब जब बेबी ने फीडिंग किया 5 मिनट और आपने देखा कि मिल्क का कलर भी थिक व्हाइट है, इसका मतलब आपके बेबी ने ब्रेस्ट मिल्क एम्प्टी नहीं किया है, वो हाइंड मिल्क आ रहा है. तो उस केस में आप या तो हैंड एक्सप्रेस कर लो या पंप कर लो 5 to 10 मिनट्स के लिए, और उस मिल्क को एक्सप्रेस करके रख लो. बच्चा दोबारा जब फीडिंग मांगेगा तब आप उसको वो मिल्क दे सकते हो. अगर आपने फीडिंग कराया 5 मिनट और आपने ब्रेस्ट को प्रेस करके देखा और मिल्क का कलर थिन व्हाइट यानी बिल्कुल ट्रांसलूसेंट आ रहा है, यानी ये फो मिल्क है, आपका बेबी ने पूरा फीडिंग कर लिया है, फोर मिल्क हाइंड मिल्क बच्चा पी चुका है, ये नेक्स्ट फीडिंग सेशन का, क्योंकि ब्रेस्ट में कभी दूध खत्म नहीं होता, तो ये फीडिंग में जो मिल्क आ रहा है पीछे का, ये वो दूध है, वो आप अपने, अगर आप थिन मिल्क आ रहा है, देन बी सेटिस्फाइड दैट योर बेबी हैज टेकन फुल ब्रेस्ट फीडिंग. अब अभी भी अगर बेबी आपका हंग्री है, then take the baby on the other breast also. So this way, Kausar, you will understand is your baby drinking properly or not. Okay, Kausar? Next is from Suman Kaur. When should we introduce egg to our baby? You can introduce egg even when your baby is completing 6 months. So there is no such problem of introducing egg or allergens. So always remember, see, the basic thumb rule of introducing solids to babies is introduce one food at a time. Suppose I started, although I will suggest you to start with dal. You start with yellow moong dal, and once your baby accustoms, like just follow a 3-day rule. So for 3 days, give dal. After 3 days, add the other group. So for suppose we started from the pulses group. Then after 3 days, add some vegetable group. What you can do, you can add palak into that. So you just make palak moong dal and give to your child. After 2 days or 3 days, when you are seeing that there are no problems, no allergies with that food, then you can add the next food group. So next food group, I can take cereal. So I can add some ragi into that. So now dal plus ragi plus palak. Now reduce the dal quantity, keep this ragi and palak more. So this way you will keep transitioning. So egg, what you can do at, suppose you're starting at 6 months completed, on the 3rd week or on the 4th week, you can add egg. So that way, whatever food items you have already introduced to your child, you can mix and match the new food item and follow the 3-day rule. So this is the easiest way, and you can give a variety of food to your child. My babies, because I do baby diet counseling to the babies also, for mothers also, for their babies. So there I introduce 8 to 10 new food items in the first month itself. Now you can imagine your baby will never be a picky eater. The baby will be introduced to so many variety of food in the first month itself, in the 6th month itself. And then when you keep moving, those 8 to 10 food items and the new food items, you can keep mix and match. So this way you will give variety of food to your child, and your baby will be a happy eater. Okay. Next question is from Sangeeta. Sangeeta says low milk supply. Okay. So Sangeeta, if you're having low milk supply, and anybody who is having low milk supply issues, so first of all, you have to understand the reason of low milk supply. Mother Nature will never do wrong. There is always abundant milk supply when the baby is born in the mother's body. But what happens? If the baby is separated from the mother and given any other milk to the baby, the brain doesn't understand. Suppose, for example, I'm just giving an example. Suppose the body starts making milk. Now, when the baby is born, there is a natural reflex to the brain to release the milk. But if the baby is not brought to the mother's breast, or the baby is being given some other milk and the baby is not creating that demand on the mother's breast, then the brain takes it as an extra milk and starts reducing the milk supply. So if we have to reverse this thing back, we have to create more demand for our brain to improve the milk supply. So first of all, frequent feeding. Now there are high chances that if you are facing low milk supply, you would have introduced formula milk to your child. So in that case, what you will do, how you will create the demand? So creating demand can be done in 3 ways. Either the baby should come on the breast, or we should pump, or we should hand express. So if your baby is coming on the breast at least few times, then I would suggest to have a combination of all these 3. First, try to breastfeed your child. Then if the baby is crying, then you can give the formula milk, and then just try in the mid-bottle feeding or the mid-katori feeding. And then in the last, you can pump. So this way, if you are creating such good demand every feeding session, definitely the milk supply will increase. Along with this, what you can do, you have to take good hydration. So you have to take 3 liters of water every day. Second, to improve the flow. The baby starts preferring the bottles because the flow of the milk is good. So if you have to improve the flow of the milk on the breast, then you have to do oil massage on the breast and then warm compress. Along with this, some galactogogues. So if you are thinking about the market preparations, usually they have preservatives added into that. So any of you who are using any kind of medications, just see at the back of the label and see if there are preservatives added into that. Usually the preservatives which are added are sodium benzoate or sodium methyl parabens. So parabens, these days we are searching for paraben-free shampoos. We are not using them even for our local use. Then how we can take it inside our body? And that too for a new mom. So you have to always find out that whatever lactation supplements you are taking should not have any preservative added into that. Then if we talk, obviously I know you will be asking me then to suggest some preservative free lactation supplements. So what I suggest is Lactomagic powder and Morocco tablets. These two things are 100% natural and they have no preservatives added into that. Then moving further, then these are the galactogurk which you have to take, and along with that you have to see the baby's weight gain. So as I told you, if you're seeing the baby's weight gain and the baby's weight is increasing, slowly start reducing the formula milk week by week. So if your baby's weight gain is there and formula milk is coming down, that means milk supply is improving. So don't worry only about the quantity of milk. It is also about the quality of breast milk. And I know I am not judging any mother, but I say that you are so obsessed about the quantity. But if suppose if I'm talking about two mothers, one mother pumps the breast and she gets 30 ml. Other mother pumps the breast and she gets 60 ml. Now, if both the babies are gaining same amount of weight, both the babies are taking same amount of breast milk or the formula milk, then that doesn't mean that the 30 ml milk who has produced is producing less. That means her quality of breast milk is better than the mother who is producing 60 ml of milk. That's why, girls, please don't be so obsessed about the quantity. Check your baby's weight gain. If your baby is gaining proper weight and the formula milk is coming down, then be happy and keep moving onto that. Okay? And also skin to skin, that is very important. So whenever you are trying to breastfeed your child, try to put the baby skin to skin with you. That will help a lot in a proper bonding and it will improve your milk supply naturally also. Okay, Sangeeta? Next question is from Poonam Patil. Can we introduce fruits after completion of 4 months? No. Fruits are a big no even at 6 months. Now let me tell you the reason. So fruits, they have a natural sugar in them. Usually at around 6 months, babies are teething. They're putting everything in their mouth and those act as a source of infection to them. Now, if you are adding fruits to the baby's diet, that gives a good medium for catching infection. So that's why from my side, I usually introduce fruits either at the 8 months or if one teeth has erupted. That is the recommendation for fruits from my side. Next question is from Jyoti. Did tea cause decrease in breast milk supply? Now it is about how much quantity. Tea has caffeine into that, which causes dehydration in the body. So 1 or 2 cups, like small cups of tea, you can definitely take. Don't take more than 2 or 3 cups. So if you are taking small teacups of 2 to 3 times tea or coffee, that's perfectly fine. Just keep hydrating your body to take at least 3 liters of water every day, Jyoti. Next question is from Tejaswini. What new mom to do for getting good flow of breastfeeding? So to improve the flow of breast milk, what you have to do oil massage on the breast and then warm compress. So what will happen when there is when you are doing massage on the breast, it causes friction in the cells, and due to that energy created there, the vessels dilate. And what also when you do warm compress, it dilates the vessel and it improves the flow of milk in the vessels. Okay. Next question is from Sonia. Breast milk supply low after medicine. So Sonia, what medicines you are taking? You have just write in the chat box. I'll just see what you are taking. If it is a preservative medicine, then please don't take that. Otherwise, whatever you are taking, let me know. Because sometimes, the doses of medicines also needs to be changed. Suppose you are advised any particular dosage for improving the milk supply and other things also. Many times mothers just rely on the medicines. So medicine is one helpful factor to improve the milk supply. It is not the only factor to improve milk supply. So if you're advised the other things also, you have to do everything together. Together as a holistic, it will help to improve your breastfeeding experience. So if you're only dependent on the medicine, it will not help. Now, if you're following all the things and still you're having low milk supply, then that means we have to improve the medicine doses. So just write what kind of medicines you are using and let me see what it is. Next question is from Shreya. How to increase milk supply? So I just answered Sangeeta's question on a low milk supply. That is the answer for yours, Shreya. How to increase the breast milk supply. Next question is from Divya. How to increase breast milk? Same answer, Divya. I have answered. And if you are joined in late, just watch this recording. It will come on my YouTube channel either tomorrow or day after tomorrow, and you can watch there. Next question is from Brini. My baby is 1 month old, but जब भी उसको फीडिंग करवाती हूँ वो रोता है. I mean प्रॉपर लैचिंग नहीं करता. मैं निपल शील्ड ट्राई करती हूँ, वो बस 5 मिनट तक लेता है, उसके बाद ही अगेन स्टार्ट्स क्राइंग. तो ब्रिनी, फर्स्ट ऑफ ऑल एक चीज आपको समझनी होगी कि जब हम बेबीज को फीडिंग कराते हैं तो खाली निप्पल बच्चे के मुंह में नहीं रहना चाहिए. एरियोला जो ब्लैक पोर्शन होता है निप्पल के अराउंड, हमें वो भी देना होता है. अब पूरा ब्लैक पोर्शन नहीं चाहिए, ओनली लोअर पार्ट ऑफ द एरियोला इज इम्पोर्टेंट. तो हम जब निप्पल शील्ड लगा लेते हैं तो निप्पल शील्ड से क्या होता है, बच्चा खाली निप्पल पकड़ पाता है. सॉरी. तो उससे क्या होता है, बच्चा खाली जब निप्पल को पकड़ता है तो थोड़ी देर तो उसको मिल्क आता है, थोड़ी देर बाद जब उसको मिल्क आना बंद हो जाता है तो बच्चा रोने लगता है. तो अगर आप लैचिंग का ट्राई करा रहे हो तो बिना निप्पल शील्ड के ट्राई कराओ. उससे क्या होगा, बच्चे को थोड़ा लैचिंग पीछे से एरियोला से मिलेगा तो बच्चा देर तक ब्रेस्ट पे रुकेगा. और अगर वो रो रहा है तो ठीक है, आप घबराओ मत. हर फीडिंग पे पहले ट्राई करो, फिर बॉटल के बीच में ट्राई करो. ऐसे करके धीरे धीरे आप हर फीडिंग सेशन पे करते जाओगे तो बच्चा ब्रेस्ट पे आने लग जाएगा. ठीक है ब्रिनी. Next question is from Vandana. What is the indication of we are generating sufficient milk for 1 month old baby? So your 1 month old baby should gain 200 grams per week. So check the weight on day 1 and day 7. If you are seeing 200 grams weight gain on exclusive breastfeeding, then you are producing enough milk for your child. ब्रिनी, इसलिए उसको बॉटल फीड शुरू करना पड़ा. ठीक है ब्रिनी, मैंने अभी आपको उसका आंसर दिया, आप ऐसे करो, ठीक हो जाएगा बच्चा. नेक्स्ट क्वेश्चन इज फ्रॉम सुमन कौर. My baby had eggs for 15 days. Everything was normal. Then one fine day after eating egg, he started vomiting and had pimples on face with redness. If this is allergy, why it happened after 15 days? So Suman, first of all, see if you have introduced anything else along with the eggs. Sorry, just a minute. Maybe something else you would have done. Either it may be on the food side or on something you would have changed, either the water intake or something there would be, Suman. Just try and see for the last 15 days what you have given. And that's why I asked all the girls to maintain a food diary. You should always maintain a food diary for your child and keep writing what you are giving to your kids. So if you are seeing any kind of allergies, you will be having your food diary where you can see what you have given to your child. So that's why I ask all of you to maintain a food diary. So Suman, just see what you have given in last 15 days along with the eggs, something you would have given. See, food allergies will not develop after 15 days. Usually it is 2 to 3 days. Within 2 to 3 days, you will see the allergies if there are any. So Suman, I don't think that it is egg. Just try to see if there is something else you have given to your child during that time. Next question again from Vandana Shinde. What is the indication of correct latching by baby? So there are few things which you have to observe when your baby has latched well, whether the baby is latching well or not. First, the cheeks should go out. Like there should not be no dimpling in the cheeks. When the baby is suckling, there should not be any dimpling in the cheeks. Second thing, both the lips should be everted outside. If the lips are inside, that means the part like the areola full is not taken by the baby's mouth. So the lips should be everted outside. Third thing, the lower part of the areola, the lower lip should be on the junction of breast and areola. That is a good indication that the baby has taken full of the lower areola. Next is the upper lip. The upper lip should be resting just above the nipple. So you will see the upper part of areola visible. That means the lower part of the areola is in the baby's mouth. Next thing is the chin should touch the mother's breast. So baby's chin should be touching the mother's breast. Why? Because you have to drink something, any liquid. And if you are looking down, then it will become difficult for you to gulp. That's why you have to open the neck. So if the neck is little up, like this neck is open, it will become easy for the baby to gulp. So that can be achieved by just moving the head backwards. So if you extend the baby's head, the chin will be touching the breast and nose will be going away from the breast. and this will open the chin. It will open the neck, and the baby will be able to drink better. Okay. Next question is from Jia Jain. Do I need to feed the baby on both the breasts during each feeding session, or else one breast will outgrow another one? Is this a myth or fact? So first of all, Jia, if you have to feed the baby, it is always good to offer offer breast milk to breastfeeding from both the breasts. Why? It is not about outgrowing. It is about the milk supply. So if you are feeding more on one side, the milk supply will drop on the other side. The main principle behind this is supply and demand. The more demand, the more supply. So if you are demanding less from the other breast, then obviously there will be less demand and the supply will reduce on the other side. Many of you would have seen that your baby had been starting with feeding from one side more. So what will happen? The milk supply, the mother always feels when the baby is hungry, the mother will take the baby on the same side. And because of that, the other breast will not get sufficient demand and the milk supply will come down. So if it is happening, Jia, so then what you have to do, you have to feed the baby from both the sides. Now, how to know when to switch? So once you are feeding from the one breast, baby has taken, baby is happy, then check, just try to put the baby on the other breast. If the baby wants to feed, that is fine. If the baby doesn't want to feed, that's okay. Next feeding session, feed from the other breast. This is one condition. Second condition, you have breastfed from one side and you feel the milk supply is not there and the baby is crying. What to do? First, press the breast and see the color of the milk. If the color of the milk is thick white, then that means the baby has not emptied that breast. Put the baby on the same side. Now, if the baby is not ready to latch on the same side, you take the baby on the other breast, but because you know that the first breast is still not emptied, then just pump for 5 minutes or just hand express and collect that hind milk. Second, if the baby is ready to come on the same breast and you saw that it is a hind milk and the baby is ready to come on the same breast, then continue feeding from the same side and switch later on if the baby still wants to breastfeed. So these are the ways of understanding how to switch, when to switch, should we switch or not. So all these things should be kept in mind when we are working on direct breastfeeding. Next question is from Vaishnavi. Baby is not latching, breastfeeding also stopped 1 month before. I want to give breast milk. Is it possible to start again? Yes, definitely. Just 1 month. Come on, it's okay. So if you have breastfed your baby even 1 month before, then there is a very small gap. You can definitely do it. But now don't waste further time, Vaishnavi. Just reach out to our team tomorrow and get your consultation done and get your issues resolved. 1 month is nothing. We can definitely get you back on your track. Don't worry. Next question is from Jhilik. How to increase breast milk? My baby feeds 3 to 4 times. She gets milk, but whole day she not get milk from my breast. Just repeating this question again. How to increase breast milk? My baby feeds 3 to 4 times. She gets milk, but whole day she does not get milk from my breast. I'm not able to understand, Jhilik. What I understand from this, that you want to increase breast milk. Your baby is able to feed 3 to 4 times, but other times she's not getting milk. What I understand from here. So first of all, here is one thing. The positive thing is the baby is at least coming 3 to 4 times. So what you have to do for every feeding session, you have to create the demand. Get the baby on the breast for every breastfeeding session. Let the baby suckle for a few minutes, whatever time the baby is suckling. Then whenever you're giving any other milk or formula milk or express breast milk, let the baby take half of the amount what the baby usually takes. And then take the baby back to the breast again. So this way, just keep creating the demand on the breast every time. And definitely your milk supply will improve. And also the baby will start coming on the breast every time. Along with that, follow the process, the tips which I gave for improving the milk supply, like hydration, milk flow, like doing oil massage in the breast. Third, the galactogogues, which I told you, Lactomagic and Morico tablets, skin to skin, and checking the baby's weight gain. Next question is from Hardika, low breast milk. So I have just answered about that, Hardika. If you have missed the session, you can watch the recording. It will come on my YouTube channel tomorrow or day after tomorrow. Next question is from Kiran Mai. How to increase my breast milk supply as I am getting only drops? So if you are getting only drops, first of all, don't worry, girls. Even 1 drop of breast milk has 3 lakhs germ-killing cells. So if you are getting milk supply in very low drops or very low amount, just think of your baby's immunity first. Take small milestones. If you are thinking of a larger picture, you will get overwhelmed. You will start worrying. So first take small steps. So first for Kiran, for you is number one is to work on improving the immunity of your child. So if you are getting only drops, don't worry, just keep doing on it. For every feeding session, if you are creating demand, as I just told you in this session, definitely it will increase. Mother nature will never go wrong. Your body, your nature will always help you. It's only that difference is we don't create enough demand. So when you create demand, and that too, I would suggest if you are having only drops, then reach out to an expert. You can reach out to the team tomorrow and get your consultation done, because under a guidance, you will be able to reach the goal fast. You will be able to do by yourself also, but there is somebody who will keep asking you every week, how was the last week? What are the improvements? What all you have done? What is the baby's weight? If there is somebody who asks you, it becomes an easier thing. It feels that somebody else is also there who is equally interested in my journey, who is equally interested in my baby's health, who is equally interested in my concern about my improving breast milk supply. So it is always better to have a guidance, and expert guidance, not somebody who is also sitting in the same boat. Many mothers, they just talk among themselves, and all of them are sitting in the same boat. How they can help each other? So it is always a best part to reach an expert guidance who has seen like thousands of mothers, who have helped thousands of mothers, and can help you now also. And when you get such mentor, then don't leave them. Many of us, you will reach out to us, take consultation for few weeks, you follow, and then you just disappear. Either Diwali has come or some marriages have come, and you feel that those are more important things. Come on, Diwali will come every year. Your marriages will keep going. If you don't attend that marriage, it doesn't mean that the marriage will not happen. It will happen. So please take care of your babies. This is the only time you have right now to give the right foundation to your child, to give right guidance to your baby, for good nutrition. That is a tailor-made milk for your child. That milk nobody else can make in this whole world what you can create for your child. So don't miss that thing. That kind of feeling is the best feeling, when you know that I can nurture my child the best way. As in pregnancy, I have nurtured my baby. Even now I can do that. So don't miss that part. Okay. Next question is from Sona. How to latch properly while sleeping position? So sleeping position latch is called as sideline pose. So you just search on YouTube sideline position of breastfeeding, and you'll get a proper latching technique for sideline hold, and that you can practice. Sona. Next question is from Neha Khambu, low milk supply. So Neha, I have already answered about this low milk supply. You can watch the recording if you have not attended the session today from the beginning. And the recording will be available on my YouTube channel either tomorrow or day after tomorrow. Don't worry. Next question is from Vandana. Are we feeling heaviness in breast if MIL? No. Are we feeling heaviness in breast if milk produces in breast? First of all, see girls, heaviness, leaking, fullness, that doesn't mean that you have a lot of milk. And absence of this doesn't mean that you don't produce enough milk. These are not the sign of milk adequacy. These are only the signs of a good oxytocin reflex. Oxytocin is a hormone which helps to push the milk outside the breast. So oxytocin hormone reflex varies from mother to mother. Fullness, heaviness, feeling of like leaking of breast, that is only because of a hormonal reflex, and it has got nothing to do with the milk quantity. So please stop worrying about fullness, heaviness, or leaking of breast. Okay. Next question is from Kanta. Flat chest also produces sufficient milk for baby. Yes, definitely yes. So don't worry about the breast size. Don't worry about the nipple size. If it is a flat nipple, if it is an inverted nipple, don't start doubting yourself. When we can nurture your child during pregnancy, your body can definitely nurture your baby even after the baby is born. Don't body shame yourself thinking I have a flat chest, I have a flat nipple, I have an inverted nipple. You just need to learn the correct techniques of latching. That's all. Okay. Next question is from Kiran. Baby does not latch and suckle. That's okay, Kiran. If your baby has been habitual to the bottles, the baby will not latch and suckle. That's perfectly fine. But we can get the baby to latch and suckle by following the tips. Today, I have given a lot of tips about latching and suckling and how to bring the baby from the bottle towards the breast. Please follow that, and definitely your baby will start latching and suckling again. Next question is from Mrs. Akram. Baby age 6 months 6 months है, स्टार्ट से बॉटल यूज कर रही किया, अब बेबी ब्रेस्ट पे आ सकती है, मैं हर फीडिंग पे ट्राई करती हूँ ब्रेस्ट पे लाने की, बट बेबी रोना स्टार्ट कर देती है, 2 वीक से ट्राई कर रही हूँ मिड बॉटल फीडिंग, क्या बेबी का ब्रेस्ट पे आना इम्पॉसिबल है? मिल्क सप्लाई बिल्कुल सही है। तो मिल्क सप्लाई अगर बिल्कुल सही है मिसेस अकरम, तो आप क्या करो, बच्चे का जैसे आपने बताया कि आप उसको हर बार ट्राई करा रहे हो, 2 वीक से ट्राई करा रहे हो, मगर अगर आपके बच्चे को अगर स्किन का फील नहीं है तो भी ऐसा हो सकता है। तो आप क्या करो, जब भी आप बेबी को जैसे आपने फीडिंग कराया, थोड़ा ट्राई किया, बच्चा ब्रेस्ट पे नहीं आया, फाइन, थोड़ा सा बॉटल उसको मिल्क दे दो, उसके बाद क्या करो, अपनी स्किन सबसे छोटा वाला जो फिंगर है बच्चे के माउथ में सकलिंग दो, थोड़ा बच्चा जैसे ही फीडिंग करना शुरू करे, फिंगर हटा के बच्चे को ब्रेस्ट पे लेना शुरू करो, पहला पॉइंट। दूसरा, बच्चे के साथ खूब स्किन टू स्किन करो, बच्चे को जब आप बॉटल भी देते हो ना, तो अपने से बिल्कुल चिपका के फीडिंग कराओ उसको, उसको बिल्कुल लगना चाहिए कि माँ से बिल्कुल चिपक के बच्चा रहेगा, तो बच्चे का जब स्किन टू स्किन कॉन्टैक्ट बेटर होगा तो उसका ब्रेस्ट पे लाना भी आसान होगा। थर्ड, बच्चे को रात के टाइम पे जब वो नींद में है, उस समय जब आप बच्चा रोना शुरू करता है तैसे ही थोड़ा थोड़ा, तो बच्चे को ब्रेस्ट पे लेने से पहले थोड़ा ब्रेस्ट पे मसाज करो, हाथ से थोड़ा सा मिल्क बना लो, उसके बाद बच्चे को ब्रेस्ट पे लो। अगर आपका मिल्क सप्लाई बहुत अच्छा है, आपने जैसे कहा बिल्कुल सही है, तो इन टिप्स को फॉलो करो और उसके इससे बच्चा ब्रेस्ट पे आएगा। जस्ट कीप डूइंग दैट एंड इट विल डेफिनेटली कम, आएगा अकरम, मिसेस अकरम, ठीक है। नेक्स्ट क्वेश्चन इज फ्रॉम अंजू. Ma'am, my baby is 3.5 years old and is entirely dependent on formula. I started my treatment on 15th November and initially I was getting only drops. Now I pump the whole day 8 times. Maximum to maximum, I am getting 6 to 7 ml per day. Currently, I am having Lactomagic powder and Moringo tablets 3 times a day and allopathic tablet, and following all the protocols given by the doctor, but I am seeing very little amount of milk in each session, 0.5 or little more or less. I am becoming demotivated. Please tell me, ma'am, if I can meet my baby's demand. How long should I wait for getting a good result? Do I need to increase the dose? Please help me. So 3.5 years old, Anju, 3.5 साल का बच्चा है। तो 3.5 साल का बच्चे का खाना वो फॉर्मूला पे क्यों है अंजू? आपका बच्चा अगर आपकी आप उसको सॉलिड्स के साथ अगर आप उसको ब्रेस्ट मिल्क दे रहे हो, आपने बोला कि 6 to 7 ml पर डे आ रहा है, ठीक है, तो आप बच्चे को इस समय आप पहली चीज तो आप फॉर्मूला उसका बंद कर सकते हो, पहली चीज। दूसरी चीज, जब 6 to 7 ml आ रहा है, तो आपने जैसे बताया कि आप 8 टाइम्स पंप कर रहे हो, यहाँ पे मैं आपको एक पावर पंपिंग के लिए एडवाइस करूंगी। आप क्या करो, आपके 2 पंप स्पेसिफिकली जो रात वाले हैं, उसमें आप क्या करो, 5 जैसे 5 मिनट्स का भी एक प्रोटोकॉल होता है, 10 मिनट्स का प्रोटोकॉल होता है, मैं आपको 10 मिनट्स वाला बताती हूँ। तो पहले आप 10 मिनट्स पंप करो एंड 5 मिनट्स का गैप दो, फिर 10 मिनट्स पंप करो, फिर 5 मिनट्स का गैप दो, फिर लास्ट में 10 मिनट्स का पंप करो। ऐसे करके आपके 30 मिनट्स का एक सेशन होगा, 2 सेशन करो आप खाली, एंड देखो अगर आपको पावर पंपिंग से बेटर मिल्क सप्लाई आना शुरू होता है तो पंपिंग के सेशंस इंप्रूव किए जा सकते हैं। दूसरी चीज, आपका जो भी डोजेज अभी चल रहा है, आई थिंक 2 स्कूप्स चल रहा है, आप इसको हाफ स्कूप बढ़ा दो, 2.5 चम्मच करो दिन में 3 टाइम्स, एंड मोरिको टैबलेट्स का आफ्टरनून का डोजेस थोड़ा सा बढ़ा दो, इसको करो। और बाकी जो एलोपैथिक टैबलेट है, क्योंकि एक पब्लिक प्लेटफॉर्म है, मैं एलोपैथिक टैबलेट के बारे में ऐसे पब्लिकली नहीं बोल सकती, दिस इज नॉट करेक्ट फॉर इन पब्लिक इंटरेस्ट, तो उसके लिए आप डॉक्टर से एक बार पूछ लो कि उसको डोजेस कैसे इंप्रूव करना है। अंजू, डोंट वरी, मिल्क सप्लाई अगर 6 to 7 ml आ रहा है और आपके बच्चे का अगर वेट बढ़ रहा है और फॉर्मूला कम हो रहा है, तो तब भी मिल्क सप्लाई इंप्रूव हो जाएगा। बट बच्चा 3.5 साल का है, तो 3.5 साल के बच्चे के लिए ऑब्वियसली थोड़ा टाइम लगेगा बेटा। अब बच्चा थोड़ा बड़ा हो जाता है तो थोड़ा टाइम उनको ज्यादा लगता है, बट डोंट वरी अंजू, इसमें भी इंप्रूवमेंट हो सकता है, ठीक है। नेक्स्ट क्वेश्चन इज फ्रॉम जानवी. Can relactation possible if the mother doesn't feed the baby even once? Yes, that is also possible. If you have not breastfeed your child even once, then also your milk supply can definitely increase, Janvi. Don't worry. Relactation is possible. Next question is from Poonam. My baby is not latching properly. He's 2 months old. So just 2 months old baby, then follow the cross cradle hold techniques. Now I'm going to tell you some techniques of how you can latch your baby. So first of all, sit straight. No bending forward. Sit straight. Have good pillow below on your lap and have sufficient height for your child. If one pillow is not sufficient, you can take 2 pillows also. 2, even 3 pillows you can take, but your baby should be in a sufficient height so that the baby is just touching your chest. Now what you have to do, hold the baby with the opposite hand. Suppose I have to feed from the left breast, then hold the baby from the right hand. Now when you are holding the baby from the right hand, your fingers should be like this in C shape and holding the head of the baby behind the ears, not the this neck. Don't hold the baby from the neck, hold the baby behind the ears. Then once you are holding the baby, then with this wrist movement, just make the baby's head go little back. So baby will be looking up while you are bringing the baby feeding. Now this way the baby's chin will be touching the mother's breast. Now how to hold the breast? Most of you hold the breast in C shape from sideways. Don't do that. You have to hold the breast in U shape from below. Now what is the reason? If you're eating a vada pav or eating a burger, you have to hold the burger like this. If you hold the burger like this, you will not be able to take a good big bite. So you have to hold the breast like this and you have to press the burger like this so that you can take a big bite. Now imagine the same thing when we are talking. So if you are holding the breast like this, your baby is like this because the baby is parallel to you. So the baby's lips are like this. Now, if you are holding the breast like this, you are making it perpendicular. It will become difficult for your baby to latch. So, holding the breast in U shape from below will help a lot in having a good deep latch. Now, when you are holding the breast in U shape and bringing the breast, your baby like this, and the baby's lips are like the chin is touching the mother's breast. Now, with the thumb, you tickle the nipple on the baby's upper lip. The baby will open a small mouth. If the baby opens a small mouth, what you do, you just like put the baby back and forth in a way that you're teasing the baby and not giving breast milk to your child. And what will happen? Your baby will get irritated, will open a big mouth and will do like this. When the baby does like this, just take the baby inside. So both the things should be working together. You are pushing the breast like this and bringing the baby together. Both the things, both the hands should be working in unison. Once the baby latches, just wrist movement again. Make the baby's head go like this so that the baby's neck is open and the baby starts gulping properly. So these are the proper position of latching, and this is called as cross cradle hold, and you can find it on my YouTube channel. There is a full video on how to latch a baby properly. Okay, Poonam? Hope this helps. I can see a lot of hearts in the screen. Thank you so much, girls. And this was the last question there. So now I'll take the live questions which you all are right. Oh, so many questions I'll take. Thank you, girls, for all these hearts. So, girls, I'm also live on Instagram right now. So I'm talking about these hearts from the Instagram girls who are writing right. Thank you so much, girls. So let me start taking the questions. Thank you so much, everyone. So next, let me just see any other questions from here. Yeah. So first question is from Manisha. My baby is 2 months old, but till now, I don't have proper milk supply. Till one morning, I have 1 drop of breast milk, but now I don't see any drop as well. Can you help me with this? So Manisha, as I told you how to improve the milk supply that you can do. But here I suggest you, your baby is 2 months old and right now getting only drops. If you work by yourself, it will take a lot of time. So Manisha, please reach out to the team tomorrow and get your consultation done as soon as possible and improve your supply. The baby is already 2 months and it is dropped. Please do that so that you increase the milk faster. You can do it on yourself also. I am not saying that it is not possible by yourself, but it will take more time. So better to get a guidance and improve it fast. Next question is from Hardika. Low milk supply and painful breastfeeding. So low milk supply, I've already answered, Hardika. You can watch the recording again. For painful breastfeeding, I have given you the tips on how you can latch. Painful breastfeeding is always because of a shallow latch. Now let me tell you how. All of you, just put your tongue on the back, like back of your, like touch the roof of your mouth. What do you see? At the back, you will see roof. There is a cave kind of a thing at the back of your palate. Now, what is that? The mother's, the baby's, the mother's nipple should go till there. Okay. That is a safe and secure position for mother's nipple. Now, where should be the, now, if you touch just behind your teeth, there is a hard part of the palate. Just behind your teeth, there is a hard part of the palate, and that is supposed to be there on the areola. Areola has bigger vessels of milk, while the nipple has thin ducts of milk. So if your nipple is safe and secure at there, and on the areola part is the hard part of the areola, this palate, then that way the breastfeeding will be a good breastfeeding, will be a deep latch, and the milk flow will be better, the milk transfer will be better, the baby will be emptying the breast faster, and it will not be painful at all. Okay, so you have to work, Hardika, on deep latching techniques. Once you master the deep latching techniques, it will never be painful for you. Okay. Next question is from Vivo V2118. So most of you don't, sometimes you don't put your names and your phones, branding is coming there, Vivo. Okay. So why baby don't latch and suckle? Because my breast nipple have inside. So if you have an inverted nipple, then what you have to do is a frame technique. Just holding the breast in U shape from below and pressing the breast. It will bring your areola to just making a pout of the areola. And the baby can latch on the areola. Once the baby starts latching on the areola and suckling it, then the nipple will get opened up out inside the baby's mouth. That will happen. And as I told you, nipples work is only to drop the milk. It is not for suckling. So don't worry if you have a nipple inside. Okay. Next question is from Anupriya. Initially post-pregnancy, I used to feel the fullness of breast. But after 3 weeks now, I don't feel that much fullness compared to the initial days. Is this normal? Am I making less milk now? No, Anupriya, this is very normal. As I just told you, fullness, heaviness, or leaking of breast doesn't mean that you don't have enough milk. That is only due to the oxytocin reflex, and usually that happens for like 6 weeks or maximum up to 8 weeks. Many times it doesn't happen for even 6 weeks also. So don't worry if you are not feeling the fullness right now. If your baby is gaining weight properly without any external milk, you are good to go, Anupriya, and don't worry about it. Next question is from Vivo. Again, why my baby so crying when bottle feeding leave? So when your baby is leaving the bottle, the baby is crying. What does that mean? I'm not sure, because if the baby is still wanting more milk, then obviously the baby will cry. Next question is from Shreya. My supply has come down since my baby is not latching. How to increase the supply? Then you can pump, Shreya. It is specifically about demand and supply. So if your baby is not latching, first of all, find out the ways why the baby is not latching. If you are still not able to figure that out, you can improve the milk supply by improving the pumping. And recently, one of our mom star, Mrs. Parul Suneja, you can watch her success story on. And yes, girls, if you need inspiration, please watch all the Mom Star series which I put on my YouTube channel. They're very motivating. You can watch them, and that will help to improve your inspiration or your motivation towards breastfeeding. So if your supply has come down, Shreya, then if you have to improve your milk supply, then you have to improve the demand, and that you can do by improving the pumping sessions if the baby is not latching. Next question is from Sudha. How to increase breast milk supply after having antibiotics? My milk supply is reduced. That's okay. If antibiotics has reduced your milk supply, you can again increase. The beauty of nature is once you start working on your supply and all the things together, again the milk supply will start increasing. So Sudha, as I just gave today's session, I have given a detail about how to increase breast milk supply. Please watch the recording again. It will come on my YouTube channel either tomorrow or day after tomorrow. Next question is from Lavanya. How to feel positive about the breastfeeding without listening to the craps told by others around us who constantly puts bad comments? Please suggest some ways. First of all, This is the best way. Just don't listen to them. I know it becomes difficult sometimes to just ignore. Just think one thing, that once your baby is growing, once the baby starts going to the school, the baby starts making friends, the baby starts meeting more people, then what is going to help your child to grow is the correct foundation which you have given to your child. When the baby will get exposed to different kind of infections, when the baby starts going to school, when the baby starts making good friends, other friends, they will exchange those infections amongst them. Now, if you have given a strong foundation to your child, you've given good immunity to your child, then who will be the best person to enjoy that perks? It is you as a mother. Every time when your child is growing up, the main thing is get affected is a mother. So right now, should focus on something will help you on a longer way. So think about that future. And when we are talking about the immunity, as I told you, even one drop of breast milk has 3 lakhs germ killing cells. So what is stopping you from breastfeeding your child? So you have to think in a way, if you have to keep yourself positive, then always remember you are giving foundation to your child. You are making the base for your child, where your baby has to make a big this building on that. So when you are making a foundation should be very strong. Recently corona came. After sometimes I am hearing some kind of pneumonia is coming in China. These kind of infections will keep coming in our world. How we survived is because of our parents work on us. So now we have, this is our responsibility to give same kind of strong foundation to our kids. Okay, Lavanya, I hope that inspires you and motivates you to keep working and just keeping all the craps around you. Okay. Next question is from Manisha. Thank you, girls. Thank you for your encouragement about my words, because I don't know whether I'm a good counselor or not, but I try my best to help all of you. Next question is from Manisha Kesarwani. My baby takes 1 hour or more while breastfeeding, and most of the time is fuzzy and keeps crying a lot. That means you have to work on 2 things majorly, Manisha. First is the flow. So do oil massage and the warm compress on the breast to improve the flow. Second thing is you have to see that the baby is doing an active feeding or not. If the baby is gulping, if you're seeing the gulping movement in the baby's neck, that means the baby is taking an active feeding. And if not, that means the baby is not feeding, just sleeping on the breast. Next question is from Sonia Bhatia. I got herpes after 3rd day of C-section and then could not feed my baby. Since then, my milk supply has come down. Now I have to give formula feed my baby 8 times a day. It's okay, Sonia. Now you can improve the milk supply. Don't worry. And you are using Lactair and Perinom. So Lactair, if you just watch your Lactair capsules at the back, you will see preservatives are added into that. So I would not recommend you any medicines which have preservatives into that. And when you're talking about Perinom, it is an allopathic tablet. It should be taken only under the guidance of a doctor, of a lactation consultant doctor. So please don't take any kind of allopathic medicines by yourself. Consult a lactation consultant doctor and they'll help you out. I personally don't prefer Perinom. I use other medications for improving the milk supply. Sometimes I give allopathic tablets, sometimes not. That depends on what is the milk supply of the mother and what is our target to reach upon. So Sonia, if you need to have any kind of expert guidance, you can reach out to the team tomorrow. They'll arrange you a consultation with our lactation consultant doctors and you can consult them. Next question is from anonymous attendee. I got herpes, same thing question. Then Neha Shetty. It is not a question. I really like the way you are helping new mommies. Highly appreciate it. God bless you, ma'am. I am so happy, Neha. Thank you so much, Neha, for appreciating the efforts. I love when you all just pump me up by these kind of comments, and this really makes boost me up to give my best. And that's why, I was taking consultations. I have been taking consultations since a very long time, and recently I started getting so many queries that by God's grace and by the blessings of you all, we have got 3 more doctors with us now. And including me, we are 4 lactation consultant doctors in the team. And I have one dedicated latch expert who helps only for the latching issues. So thank you so much, Neha, for appreciating the efforts, and all the best to all of you to get your babies on exclusive breastfeeding. Next question is from Kanta Chauhan. I have a flat chest and my chest is not increased during pregnancy. Now I am facing issues related to low milk supply, flat chest effect on milk supply. No, Kanta, not at all. Please don't worry, Kanta. And what I remember, you also checked your prolactin level, and I think you are the same one. And you discussed with the team, and they also told me that there is somebody who is asking about the prolactin levels. So, Kanta, please don't worry about the flat chest part. Please don't body shame yourself, as I just answered your question previously also, but as it has come again on the chat box, so I'm answering it again. Please, girls, don't worry about your nipple size, your breast size, about how much nipples you have, small nipples, inverted nipples, flat nipples. See, you have to respect your body. And your body is, if your body is able to nurture your baby during pregnancy, even now you can do. And always think, why are only humans having problems with the milk? Why no other mammal species are having such issues? Because we apply our brain into that. Just follow the nature. Just work on demand and supply, and it will definitely increase. Next question is from Kiranmai. Madam, I am getting only drops of milk when I express with hands. It's 15th day. Kiranmai, I have already answered your question. You have written in the Google form also. I answered it. नेक्स्ट क्वेश्चन इज फ्रॉम एनोनिमस अटेंडी. किस बेबी को बॉटल से ब्रेस्ट पे वापस लाना पॉसिबल है, जबकि मुझे फ्लैट और इन्वर्टेड निपल प्रॉब्लम है, बेबी एज 6.5 महीने का है. 6.5 महीने के बच्चे के लिए आपको बहुत पेशेंस की जरूरत है. 6.5 महीने का बच्चा अच्छे से समझ जाता है बॉटल को समझता है, सब कुछ समझता है. लेकिन अभी रिसेंटली एक 10 महीने का बच्चा भी ब्रेस्ट पे आया है, तो आपको बस वही ध्यान रखना है कि बच्चे को बॉटल के बीच में, बॉटल से पहले बच्चे को अपने से चिपका के रखिए. लॉट ऑफ स्किन टू स्किन. रात में नींद में बच्चा अगर उठता है तो उसको ब्रेस्ट पे लेने का कोशिश करिए, और मिल्क सप्लाई पहले अच्छी करिए. इस तरह से करिए तो चांसेस हैं कि आपका बच्चा भी ब्रेस्ट पे आ सकता है. और फ्लैट और इन्वर्टेड निपल्स का इश्यू वहां पर नहीं है जब आप प्रॉपर टेक्निक्स फॉलो करोगे. लैचिंग की अगर आप प्रॉपर टेक्निक्स फॉलो करते हो तो फ्लैट और इन्वर्टेड निपल से भी आप बेबी को फीडिंग करा सकते हो. Next question is from Bhavna. After drinking breast milk, my baby is vomiting when I try to burp. Why like that? Maybe you are overfeeding your child. So what you do, you breastfeed the baby for a few minutes, and then first you burp and then feed the baby again. So give a break in between, which will help to release the gas which the baby is having. And also it means either the let down is very fast, the baby is gulping the milk fast and getting a lot of air. So watch this, Bhavna. You have to just work on improving the latch and just burping the baby in between. Next question is from Anju. Ma'am, my baby is 3.5 years old. So Anju, I have already answered your question. You wrote in the chat, in the Google form also. Anonymous attendee. किस स्टोर हुआ ब्रेस्ट मिल्क सेम है फ्रेश मिल्क की तरह? बिकॉज मेरा बेबी डायरेक्टली नहीं लेता तो मैं उसे पंप करके देती हूँ, बट घर वाले कहते हैं क्या फायदा. और सेकेंड, स्टोर मिल्क माइक्रोवेव में गर्म कर सकते हैं. तो पहली चीज तो, अगर आप ये सोच रहे हो कि रखा हुआ मिल्क क्या फ्रेश नहीं है, वो फॉर्मूला मिल्क से अच्छा है, पहली चीज तो आपका ब्रेस्ट मिल्क है. इतना मेहनत का मिल्क है वो बाबा, उस पर पूरा विश्वास रखने का रहे. आपका ब्रेस्ट मिल्क है, उस पर बहुत अच्छे से वो करो. जो लोग बोल रहे हैं ना उनको बोलने दो. कोई फायदा, जिसको लग रहा है ना क्या फायदा, उनको बोलो ठीक है, तुम अपना फायदा तुम्हारे पास रखो, मेरा बच्चा है, मेरे को करने दो. आप अपना मिल्क को पंप करके भी देते हो तो भी उसका क्वालिटी, उसका न्यूट्रिशन बहुत अच्छा रहता है. प्लीज डोंट वरी कि पंप करके मिल्क देती हूँ तो खराब हो जाता है, ऐसा कुछ भी नहीं है. ठीक है, न्यूट्रिशन वाइज उसका मिल्क भी बहुत अच्छा है. फॉर्मूला मिल्क से तो लाख लाख अच्छा है यार. कम ऑन, ऐसा मत सोचो, इतना मेहनत का मिल्क है, पंप करना आसान नहीं होता. डायरेक्ट फीडिंग में एक बार, सॉरी ऑल द डायरेक्ट फीडिंग मदर्स, pumping is not easy because you have to pump, you have to sterilize the bottles and all that. So pumping is not easy, और आपका मिल्क पंप किया हुआ भी इक्वली इम्पोर्टेंट है. ठीक है, और स्टोर किया हुआ मिल्क में माइक्रोवेव में गर्म करने को नहीं एडवाइस करती हूँ, क्योंकि माइक्रोवेव करने से क्या होता है कि हीट इसमें वो एब्जॉर्ब कर लेता है, कभी कभी बहुत गर्म हो जाता है दूध. तो अगर आपको मिल्क को गर्म करना है तो आप या तो वार्मर ले लो या नॉर्मल पानी को गर्म करके उसमें बॉटल को रख दो, उससे वो गर्म हो जाएगी. नेक्स्ट क्वेश्चन इज फ्रॉम अनुप्रिया. Thank you for answering the previous question, ma'am. I have a long nipple and my baby is 3 weeks old. The areolar part, how much should be inside his mouth? How do I know if I doing deep latch or not, ma'am? So what you have to do, Anupriya, you have to, first of all, most welcome for your thank you. Second part, if you have a long nipple and you feel the areolar part, then you have to only latch the baby from the lower part of areola. You don't have to give the full areola part. So how you will make it sure? Once your baby has latched, then make sure your nipple should be pointing towards the upper part. And how you will watch, once you have latched the baby, just look at the baby's mouth. So if your baby, you will just see that your nipple is not pointing in the middle of the baby's mouth. The nipple should be pointing towards the upper palate. So if you are seeing that the nipple is pointing towards the mid of the mouth of the baby, just extend the baby's head by your wrist. Though when you make the baby's head little back, the nipple will start pointing towards the upper palate. And that is the correct way of latching your baby. Okay, Anupriya? Next question is again from Anupriya. My 3-week-old baby feeds for 5 to 10 minutes maximum and sleeps. After putting him to the bed, he will start crying again by sucking his thumb. How to find out he's full or not? How should I feed him even after he sleeps? So first of all, if he's sleeping for feeding for 5 to 10 minutes and again he's sleeping, then what you do, first you press the breast and see the color of the milk. If the color of the milk is coming thick white, that means your baby has not completed breastfeeding. So like not emptied the breast. You will understand that the baby will ask milk after some time. If the baby has fed and you press the color and see the color of the milk as thin white, that means the baby has completed breastfeeding and the baby will sleep for a longer time. So just follow one of this thing. Second thing, as I just told you about the deep latching technique, then you latch the baby in the same way and just watch the suckling part. If the baby is having deep latches like suckling, that means the baby is doing an active feeding. And if it is not, the baby is sleeping. So this way you will understand he's full or not and how you can feed him even after he sleeps. Then first latch him in a proper way and see if he's doing a gulping movement. If he's not doing a gulping movement, he has gone into deep sleep. You can't latch him with that way because that will be very tiring for you. If you see the gulping movement is there, then you can feed him in the sleeping position also. Manisha says how to do a hand express. So you can just watch on my YouTube channel. There is a full video on how to do a hand express and you'll find it out. Next question is from Meenakshi Verma. Ma'am, what to eat my 9 months baby? So if you are 9 months pregnant, you can take anything you want, but try to focus more on proteins. Have more proteins. If you are a vegetarian, have more of sprouts, have whole grains. If you're a non-vegetarian, have 2 eggs per day and you can have non-veg thrice a week. And along with that, have more dairy food in your diet. Also try to have seeds in your diet, which will improve the protein intake of yours. Next question is from Vivo. What is the position of inverted nipple when baby proper latch or inverted nipple? Yes, baby can latch on the inverted nipple. You have to follow the cross-cradle hold, which is very good for having a good deep latch. Next question is from Jasveer Kaur. Which cereal can we give to the baby when we start solids? So if you talk about cereals, then this broken wheat is very good, which we call as dalia, or in Telugu they call as godum rava. That is very good for if you are asking about the cereal. But if you start, then start first with dal and then add in vegetables into that, then go for the cereals into that, and then keep adding into seeds and nuts group also. So different food groups, if you keep adding in the baby's food, that will give diversity to your baby's food. Next question is from Suman. Can we add ghee to a 6-month-old baby? Yes, definitely you can add. Next question is from Vaishnavi. Baby not latching, ma'am, how to overcome? I just gave a good demonstration on how to latch. That will help Vaishnavi. Next question is from Make My Place Interiors. Does small breast size means low milk supply, bigger the breast, more milk production? No, not at all. This is just a myth. Never. Next question is from Kajal. My baby is preterm, but he is not taking breastfeeding. It's okay. If the baby is preterm, it will take little time for the baby to latch. So just try to pump out the milk and hand express. So it will improve the demand and the breast milk will improve. And slowly as the baby grows, keep trying now also. And as the baby starts growing, you will start seeing that the baby will better cooperate on the breast. A lot of skin to skin is required. Better. Next question is from Lucky Doll. How much quantity is 10 months old baby? So it doesn't mean that if your baby has if the baby should triple the birth weight by one year. So it's around 10 months. So you just see, suppose if your baby was born 3 kgs, if right now the baby's weight is around 8 kgs, that is perfectly fine. Sorry, 369. Yeah, definitely. Next question is from Garima. No, previously, as I told you, they should triple the weight by 1 year. But WHO says the babies who are born between 3 to 3.5 months should have around 8 kgs at 6 months, which is an ideal weight. So if your baby was born 3 months and now the baby is 10 months, the baby should at least be around something around 10 kgs nearly, that way. Next question is from Garima. How to make sure baby is doing active feeding, cause the moment he comes on the breast, he sleeps. So if you're, that can be achieved, Garima, by having deep latching techniques. And today in this session, I told you how to have a deep latch. You can watch the recording again. And when he comes on the breast, he sleeps. You have to see the gulping movement, which will make you realize whether the baby is doing active feeding or not. And how to have a deep latch, that I have explained today. Watch the recording again. From next question, next from Vandana. Thanks a lot for the session. Most welcome, Vandana. Most welcome, dear. Next question is from Garima. My baby is getting combination feeding, so even some amount of breast milk will help in immunity. Yes, definitely, Garima. It will definitely improve. Like it will help in your baby's immunity. Kavita Bhargav says कि तक कितना दिन में सूखता है मैम? मुझे समझ में नहीं आया क्वेश्चन आप क्या पूछ रहे हो. Good. So good to have the questions answered today. And Anupriya says, thank you, ma'am. You are seriously super awesome. Lots of love to you, ma'am, to conduct such a session for free and helping many mothers. You are so calm and giving time for us. We feel blessed. You are so great and inspiring, ma'am. Most welcome, Anupriya. It's always a love to see such good things written, and it flatters me also. It's human to have good flattering words. But thank you so much, Anupriya. It is always a pleasure to help and guide moms. So I have been thinking of doing some kind of challenge, like some pumping challenge or some breastfeeding challenges or something like that, which motivates the mothers. So if you all have any kind of suggestions, you all are part of my 30 days email series. Some suggestion which you feel that I should do, which will help all the mothers in a group, and that way it will help. You can put on your suggestions in the like email, and I'll try my best. We can have such kind of like group challenge where the mothers can keep motivating each other and be a buddy system kind of a thing. If you are a pumping mother, then 2 pumping mothers can be put in a pair who can help each other in motivating each other, and I'll be like a mentor to that group and where I can help you all. So if you have any kind of suggestions, you can just send me an email and we'll try to have it. Okay. So, okay, girls, take care. So bye-bye, everyone. And lots of love to you all. Take care. Bye-bye.